You have likely been told many times that if you want to lower your anxiety, you should stop drinking coffee immediately. The idea of coffee effectively lowering your anxiety might sound completely counterintuitive to most people. For many individuals, the relationship between caffeine and the human nervous system is viewed as a source of stress and jitters and racing hearts. However, the biological relationship is much more nuanced than its popular reputation suggests. New research continues to reflect this fascinating complexity in ways that might change how you think about your morning cup. A significant new scientific study has recently discovered that moderate coffee drinkers were actually the least likely to develop anxiety and depression over time. This research did not just look at a few hundred people for a few weeks. Instead, it analyzed deep data from one of the largest health resources in the world. The study found a very specific sweet spot that appears to enhance the natural mood-boosting benefits of the coffee bean while keeping the negative side effects at bay. If you are someone who struggles with your moods or feels frequent tension, staying with us for the next few minutes might provide the clarity you have been seeking. This incredible 13-year study was led by researchers who pulled data from more than 460,000 adults. To be precise, there were over 460,000 participants enrolled in the United Kingdom Biobank dataset. All of these individuals were free of any diagnosed mood or stress disorders at the very beginning of the research period. This is an important detail because it allowed the scientists to see if the coffee habits actually prevented the onset of these conditions in healthy people. The participants were followed for a median time of 13.4 years. Throughout this long duration, the researchers carefully tracked exactly how many cups of coffee the participants reported drinking each day. The researchers then analyzed medical records to see who among the 460,000 people went on to develop clinical conditions such as anxiety and depression. Using medical records rather than relying on self-reports from the participants increases the reliability of the outcomes significantly. Instead of grouping people into simplistic categories like coffee drinkers and non-drinkers, the researchers broke the intake down into several different levels. They mapped out exactly how the risk changed across that entire spectrum of consumption. They even tested whether the specific genetics related to caffeine metabolism shifted the final results. What emerged from this massive pile of data was not a simple straight line. It was something far more interesting, which scientists call a J-shaped curve. This J-shaped curve represents the relationship between coffee and mental health with incredible precision. The people who drank a moderate amount of coffee, which is about 2 to 3 cups per day, had the lowest risk of developing mood and stress-related disorders over the entire 13-year period. If a person drank less than that amount, or even none at all, the protective benefit was not as strong. However, if a person drank more than that amount, especially 5 cups or more per day, the risk for anxiety and depression started to climb again toward higher levels. This middle range of 2 to 3 cups appears to strike a very delicate balance that your nervous system can work with effectively. It provides enough stimulation to enhance your alertness and cognitive function, but it does not provide so much stimulation that it pushes the body into a state of sustained and unhealthy stress response. One of the most interesting findings in the study from Ava Durgan and the research team is that this pattern held across multiple different coffee types. Ground coffee and instant coffee and even decaffeinated coffee, all tracked in a very similar way. This is a vital piece of information because it hints that caffeine is not the only player in this biological game. Coffee is far more than just a delivery system for a caffeine rush. It contains a complex mix of bioactive compounds that appear to influence our brain health in multiple different ways. While caffeine affects neurotransmitters that are tied to motivation and mood, like dopamine, there are other elements in the bean that are just as powerful. For example, coffee contains a wide range of antioxidant and anti-inflammatory compounds that contribute to its beneficial profile. Modern medical science is increasingly showing that chronic low-grade inflammation is a major factor in the development of depression and other mood disorders. Therefore, being exposed to substances like coffee that help to modulate that baseline level of inflammation could have very meaningful and positive effects over time. There is also a secondary behavioral layer to consider. Coffee is known to reduce perceived fatigue, which changes how you engage with your daily life. When you feel more capable and energized, you are much more likely to follow through on the healthy habits that protect your mental health, like moving your physical body or socializing with friends or staying focused on your goals. If you are already a regular coffee drinker, these results are not a call to cut it out of your life. Instead, it is a prompt to get much more precise with your daily routine. 2 to 3 cups per day appears to be the most reliable range where the benefits outweigh the downsides for the vast majority of the population. This does not mean you need to hit that exact number every single day, but it does suggest that more is certainly not better when it comes to your mood. If you find yourself creeping into the range of 4 or 5 cups or more, you should pay very close attention to the subtle signals your body is sending you in the afternoon. Look for feelings of restlessness or increased jitteriness or difficulty falling asleep at night. These are often the first physiological signs that your intake has crossed your personal threshold of tolerance. It is also very helpful to look at the timing of your coffee consumption. Having your coffee earlier in the day tends to work much better with your natural biological rhythms. Late-day intake is far more likely to interfere with your sleep cycle, which then feeds directly back into a more negative mood the next morning. While this is an observational study that shows association rather than direct causation, the scale of the design is very compelling. The researchers adjusted for many different lifestyle variables, including social habits and baseline health, to ensure the data was as accurate as possible. The consistency observed across the different coffee types and the clear dose-response pattern makes a very strong case for the role of coffee in protecting our mental well-being. Managing your mental health is about making small and conscious adjustments to your daily habits. If you are already a devoted coffee drinker, you can feel more confident that your routine is likely supporting your resilience as long as you stay within that healthy middle ground. Finding the amount that works best for your unique body is a simple but deep way to take control of your daily mental state. We are very curious to hear about your experience with coffee and how it affects your feelings of tension or relaxation throughout the day. You should share your thoughts and your specific daily routine in the comment section below so we can learn from each other. If you found this detailed breakdown of the 13-year study helpful, please consider clicking the subscribe button to support the channel. Understanding the science behind our daily choices is the first step toward a more balanced life. Take a moment to enjoy your next cup of coffee with the knowledge that you are likely doing something good for your long-term mental health, as long as you stick to that researched sweet spot. Your mind and your body work together, and finding this balance is a powerful way to nourish both.